Andy from Crowd Health, something that I have just been immersed into this awesome carnivore community. And so Andy from Crowd Health, he was just about to tell us how he got started. So this is a community for healthy people where we can crowd fund, essentially people who prioritize healthy living, eating, lifestyle, and all these things, and just stop subsidizing kind of sick care, really. So tell us.
Yeah, I mean, we're a community of people who take their own health seriously. We just had the first half of this podcast talking about how important it is that when we do things in our 30s, 40s, and 50s, how they impact us in our 60s, 70s, and 80s. And so we have a group of people who say, hey, I'm healthy, I'm taking care of my body, I'm doing it right. I'm willing to help other people who have something come up. Mm-hmm. And so, we've got a community we've signed up almost 9,000 people so far. And we fund lots of accidents, people doing mountain biking, face plants,
sure. Living life outside.
A lot of people who are having babies. So we got a lot of pregnancies, we got a lot of accidents. And so, those are the types of things that we're funding, as opposed to all these chronic conditions mm-hmm. associated with lifestyle choices, primarily eating processed garbage. Right. 25 cents out of every dollar that you spend on healthcare goes to diabetes. Mm. And we know, I believe, that diabetes can almost be eradicated, at least type 2 diabetes can almost be eradicated if you go on an animal-based diet.
Right, I
believe
so.
So we've got lots and lots of people who agree with that, do not want to subsidize, that lifestyle. We actually have a t-shirt that says, "Stop subsidizing vegans."
Yeah, exactly.
So we got a lot of people out there who want to fund others who believe in this lifestyle choice.
Right.
So I was just saying, I started, I moved to Austin 10 years ago. I had health care through my employer, but I had sold my company, and so I was losing my health care. And as a result of that, I had to go find some other options. So I went what I thought was the only option, which was Obamacare. And so for me, my wife, and my 2 girls, it was $1,200 a month, $12,000 deductible, which means that we're paying like $25,000 or something like that before the health plan pays a dime.
Right.
And I was like, okay, well, this is, I guess, what all I have. And I kind of joke it worked until I had to use it.
Sure.
My little one, who was 1 at the time, was having recurring ear infections, and so we had to go to the ear, nose, and throat doctor, who said, oh, she's got a hole in her eardrum. So you have to get tubes in her ear. So we're like, okay, we'll go and do that. We went to an in-network place to do it, got the bill, and it was $8,000. And I was like, wow, it was a 15-minute procedure, and it was $8,000. And then my health insurance plan said it was medically unnecessary, and so they weren't going to pay for it.
Oh my gosh.
And so we had to stroke an $8,000 check to the local, surgeon to do her thing. And I was like, hold on a second, like, this doesn't make any sense. When I need you, you're not helping me in something as benign, as a hole in my daughter's ear that was, I know, resolved because she stopped having ear infections.
Typical insurance move. Huh?
It's an insurance move. And the more I realized, more I researched, 1 out of every 6 of those claims are denied. So you have a 1 in 6 chance when you submit a claim that it's denied. And if it's a $100 bill, it's not that big of a deal. If it's an $8,000 bill, it's a big deal.
Of course.
If it's a $25,000 bill, it's a real big deal. And so I said, there's got to be a different way of doing this. In a group of people that share the same lifestyle as me. And so we started Crowd Health, which is basically, like I said, a group of people who have chosen to live a healthy lifestyle, who are willing to help other people in their community when they raise their hand and say, hey man, something bad happened to me, because it could always happen. Flukes happen, and it's been an incredible journey, and we've funded $8 million worth of bills over the last 2.5 years. Wow. 99.8% of the bills that have been submitted to the community have gotten fully funded, and it's everything from a virtual pediatric visit of $69 to a brain hemorrhage, which was hundreds of thousands. We've had 20 cancer cases. We've had all kind auto accidents, motorcycle accidents, big and small, have been able to be funded by the community. So,
and kind of all those incidences that aren't necessarily something that you could change from, diet and lifestyle, right? It's
Exactly.
they're trying their best to like eat and live a healthy lifestyle. Not that they have to abide by, you have to just eat this amount of steak and this amount of, butter or whatnot.
Exactly.
It's just really having more intentional choices with your food and lifestyle.
Yeah. 75% of the expenses are wellness visits, so people just go into a OBGYN or a pediatrician. Injuries, which means that you had a mountain bike face plant, you're out doing life and something happens. Or pregnancies, which we have a lot of people in our 20s and 30s. They have babies. Those things, sure, I'm happy to fund those things. So the great thing about us is you know exactly where your money is going.
Right.
So if I have a broken arm, and you agree to help me, your money goes directly to me to help me with my broken arm, as opposed to United Healthcare or some big, healthcare conglomerate where you're like, I don't know where my money is going.
Yeah.
So
let's break this down then. So people pay, they just, how does one even get accepted into the community, right? It's like if you believe in eating right and exercising, is this step one? So just walk us through.
That's step one. And so we've got a specific crowd of people that we're calling the carnivore crowd.
Okay.
So while it's a carnivore crowd, it's more of an animal-based crowd where most of your calories are coming from animal-based sources.
Yeah.
And to get into that, you actually have to have either a visceral fat level that's in the bottom 25%, or you have to have a fasting insulin level below 5.
Okay. So if you are on my live and you're tuning in, if you go in and you type the code capital animal BB, you can definitely get entered into the community. And so this scan and this fasting insulin test is something that you would submit after a few months of being in the carnivore community, right? So that we can kind of see that we are a healthy individual entering
within the first 3 months that you join, you have to submit one of those to stay in that community.
Okay,
so
great.
Or you can do it beforehand if you want to and submit it afterwards, but it has to be within 3 months of you joining or after 3 months. So just
you're here supporting us the whole way, right? So we can ask you guys hey, can I get blood work done? And so how does that work? Like the question of, hey, Andy, I want to go get my fasting insulin and also my visceral fat tested. How do I do that and where do I go?
Yeah, you can call into us or you can email us or you can text us and say, hey, I want to get these 2 things done. Where's the best place for me to go and do it?
Great.
Or
and
if you have
anywhere in the U.S.
Anywhere in the U.S. We're all 50 states, Puerto Rico, D.C.
Yeah. Oh, okay, cool.
So all over the place. So yeah, the great thing about starting a company is I could just do what I want. One of the things I wanted, which I hated about health insurance, is having somebody internally I could talk to, as opposed to calling a call center in Singapore or something, where you're like, what the heck? So you have a care advocate internally. You can ask him or her anything that you want. They will direct you. They will be your ally, your Sherpa, as you go through the medical journey. Right. So go get your visceral fat, which is a DEXA scan, or your fasting insulin. You can do that at any lab. We can help you find a lab.
Great.
You submit that to us either before you join or after you join. You use your code and you get it's $99 for the first 3 months. $50 comes to Crowd Health to pay our bills. $49 goes to somebody else in the community that's having a health issue of some kind.
Okay, and so is that $49 determined by you then? So our membership, $60 to you, did you say?
Say again?
How much to Crowd Health?
$50 to us.
50 and then 49. So and that's just the membership, and then 49 goes to you to decide kind of within the community where that goes, right?
And we'll ask you every month.
Right.
Hey, would you help Mary who fell off her bike and broke her arm?
Sure.
And you can say yes or no.
Right.
Or you can automate that. If you want to say yes for everyone, you can.
Okay.
So money goes from your $49 goes from you to Mary. Mary has an account with us at Crowd Health, so that let's just say it was $1,000. And so once she has $1,000 in that account, then she can go and pay for her broken arm.
Cool. So the $49, it's garnished off of our membership. So it's not like I say yes and then pay an additional money, or do you have that option to help?
It's we ask you twice. One is for $50.
Yep.
That's automatic. That's just on the anniversary date of when you join, and it goes directly from up to us.
Great.
And then we'll ask you throughout the month for that extra $49, and that $49 will go to Mary. And so you actually you have 2 invoices per month, but it's because one's coming to us. We don't touch the other amount. It goes directly from you to Mary's account, and so she has enough money to pay for her broken arm.
So what if I said no to Mary?
Right, you can say no.
Yeah.
We will ask you again and give you another option.
Okay.
Let's just say somebody wants help with something that you don't want to help them with. I don't know what that would be. But you can say no, we'll ask you again. But if you say no multiple times, we let the community know that you're somebody who says no, 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 no.
Sure, right.
So if you were to ask for help, we would let the community, over the last 10 times we asked you, did you say yes, 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 yes?
Right.
Or no, 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 no. So you know if you're a good member of the community or not.
Right.
So, and we've done this, I think we're at our 20,000th bill or something like this. Okay. And so the system really works well. Yeah. It's not a burden. Again, we just ask you once a month. You know, and you can put an auto set that says, hey, everything that, you know, the member's a good community and the bill is reasonable, I'll say yes to, and you can automate that if you want to, or you can manually do it and go, you know, yes or no. Right. So it's super easy, but it does have a connection with another person in the community as opposed to sending my money to United.
Totally. Right? Yeah, because you don't know where that money goes, and I struggle with that because where does it go? You know, funds big pharma. Yeah. And at least it goes somewhere if you're not using it, and which was always my struggle with healthcare. I'm like, well, if I never go to the doctors and I never have these bills and I never have, you know, all these things that get billed to insurance, shouldn't they just give me money back for being healthy? And that's never the case, right? Yeah. Because they just take. And then the transparency issue is the fact that you don't know where it's going. Mm-hmm. Here, it's really nice because you know that $50 is going to you guys to keep running and to keep helping us, like not only from a support standpoint, but also just to, you know, like a support standpoint with an actual human as opposed to a call center, as well as the support of, you know, your resources, because now you guys have sort of a list of recommended doctors, which is super nice. And I know we talked a little bit, you know, about doctors and your daughter going in for the eardrum surgery and whatnot, and now you're growing too and very resourceful, and many people are looking for that. We are looking for doctors who don't give us the side eye when we're like, yeah, we eat meat, and then they think we're crazy, and then they want to prescribe us a statin and for a high LDL, which isn't the whole story, right? And so I think the people that do believe in real health for sure is this is really something exciting, I think, and something that I haven't seen before. So thank you so much for having this platform, and thank you so much for this conversation with just being like transparent and, you know, where the funds are actually going. Yeah. So that's really exciting for me too, is just to know that if it doesn't go to me, it definitely goes, and I know who it's helping exactly from just the transparency. And then you also have a like a little chat and a Telegram and a community that's actually talking to each other.
Yeah, we've got a decent sized community. I think, you know, we've I don't know, it's several hundred people now, but there's a lot of chatter on it around, you know, what doctor are you going to? Your doctor said a statin. What do we do? Do I change doctors? These types of things. And so it'd have a good, lively conversation, because we have people who are hardcore carnivore. We have keto. We have Whole30. We've got all kinds of people within this community who are, you know, duking it out, which is kind of fun, and it's all done in a respectful way. Right. One quick story on this direct person. We had a 19-year-old Abby in Tennessee who cut off her fingers in a boating accident, and as you can imagine, the bills were tens of thousands of dollars. Sure. And so we went out to the community and we said, hey, will you help Abby with, you know, this reconstructive surgery and all kinds of things? And people were like, absolutely. Sure. We actually had people come back and said, hey, instead of asking me for $100, can I give $200?
Oh, I love that.
Because you know that there's a person on the other side of this that is struggling with something, as opposed to United Healthcare. We have people who have miscarriages. Again, we have women who come back to us and we're like, I know what this feels like. I know the pain that they're going through. I can't really help because I'm 1,000 miles away, but if I can give more money to that family just to help them, I'd love to do that. Right. Like, that's the power of, like, being in a community of people who are getting after it in the same way and are willing to help each other. Like, it's a cool thing. I feel great writing a check to Mary or Bob or whoever, because I know I'm helping them.
Yeah.
You know, as opposed to United Healthcare, which I think they're screwing me. You know,
Yeah.
so that's the difference. Do
Right.
you want to give money to somebody in your community, or do you want to give some money to, you know, a big, massive corporation that's one of the top 5 or 10 largest in the world?
Right. And I think it's a good kind of hybrid model too, where not only are we going back to just sort of that tribe, like what's in our small community, even though we're leveraging some of these things, like such as, you know, technology from our support system on the Telegram to the apps and to all these things, it's helpful. Like we can use modern, like, happenings today, whether it's technology, even modern medicine, sometimes for specific needs when it's needed. However, to use that chronically as a crutch is the issue. And so I feel this is a nice hybrid between getting back to that tribe mentality, sharing what works and sharing what doesn't via, you know, whether it's doctor resources and things like that, and also like what's just worked at home with feeding your kid animal based and all of these ideas, and then as well as bringing the community together financially too to support your, you know, your little tribe. And I think progress is also unlearning or shedding, and it doesn't always have to be accumulating and moving forward and all these things that sort of I feel like we're pressured into do. It's just this like constant like busy accumulation, all these things. Progress also means unlearning and shedding and just sort of getting back to what we were once is just that tribe and human, and you know, and so I think we're starting to see that shift in the food system as well too, with the animal-based community growing and getting back to eating nose to tail and really like simple foods and not so much processed and all. So it's just like in my brain, like healthcare also looks like process, right?
Yeah, we've been psyoped to think that we have to have health insurance.
Sure.
If you don't have health insurance, what are you going to do?
Right.
You know, what are you going to do? It's like, well, what have they done for the hundreds or even thousands of years before you had health insurance? Your community gathered around you and they helped out and they were willing to, you know, step in when they need to.
Right.
In the agrarian communities, if you got sick or hurt or injured or whatever, and you needed the fields plowed, somebody would come over and help you and plow your fields with you. And like, that's the beauty of this, is we're kind of getting back to where we, I think, should be. Whereas I feel like over the last 50 years especially, the government, insurance have kind of come in between me and you and said, hey, you don't have to help Lindsay, you don't have to do, you know, we got Lindsay. It was like, no, your community should come around you and help, right? Like that's the beauty of a tribe.
So I really love that this is here from a financial standpoint too, because what you guys do at Crowd Health as well is you almost cut medical bills in a third of what they charge via, you know, through insurance and all of that, right? Because doctors are really looking to work with those patients who do pay out of pocket, right? And so we're kind of considered a community that does pay out of pocket. Can you tell us a little bit about that?
They love that. So every doctor has about 3 billers to bill for health insurance.
So it's just like
they spend a day of their week fighting health insurance, whether getting pre-authorizations for procedures or fighting on behalf of the patient because the health insurance denied it. And so what we come in is like our members come in and pay in cash.
Yes.
We enable them, like I said, if Mary has the $1,000 bill and we can fund that before she even walks in the door and says, here, doctor, here's $1,000, that doctor gets paid immediately. They don't have to have a biller bill it. They don't, you know, have to have massive fees to build these things. And so doctors love it. So they're saying, hey, bring more people to me because I want to get rid of insurance too and just take cash pay patients.
Right.
And as a result of that, of taking away all of that of middle layers of expenses, we're able to get the prices down by between 50 and 70% of what health plans pay. And as a result of that, not only have a bunch of healthy people who are in the same group funding each other's health expenses, which is a lower utilization of healthcare, but when you do utilize healthcare, we can get the bills down significantly. And we negotiate on your behalf. So it's not like we're asking you to negotiate with your doctor. All we ask you to do when you go to your doctor is say, hey, do you have a cash pay price? And typically that's much, much lower than what the health plans pay.
Right.
If you have a big ER visit, you get the bills at the end, you submit them to us, and then we actually have attorneys who will act on your behalf to negotiate with the hospital to reduce those bills. Let's just say you have a $20,000 ER bill. We reduce it to 10. We come to you and we say, hey, we reduced it to 10. Is that okay? Can we go get it funded? Yes, great. We'll send it out to the community. Within about a week, we'll have that $10,000 sitting in your account, so you can then go and pay that ER bill.
Right.
Super simple. You know, if you're in the ER,
so good.
the last thing you want to worry about is having to pay it. You know,
right.
a lot of these Affordable Care Act plans, you've got $5,000, $10,000, $15,000 deductibles. You're like, oh my gosh, like I gotta pay $5 or $10 grand as a result of being in the ER.
Yeah.
For Crowd Health, all we do is ask you to pay the first $500 of any health event. You have to have some skin in the game before we'll fund it to the rest of the community.
Sure.
So a $20,000 ER bill, we get it down to $10,000. You pay the first $500.
Yep.
We'll fund from the community. The community will help you fund the remaining $9,500, and then you use those funds to go and pay the ER bill. It's super simple,
yes.
and you don't have to deal with the big explanation of benefits that your health insurance plan pays you. You're like, what do I pay? What do I not pay? What do you? It's so much easier than health insurance.
You know, so there's also this mindset too, which I really enjoy about wanting to enter this crowd that feels responsible too, where you know you are a responsible individual for your own health. So not only are you doing that through, you know, food and wellness, and then if something happens to you, you know, that's fine, but you're a part of this community that you also want to give to, for sure. Kind of like you were saying with that story too, it's like, hey, can I give 200? And giving also does come back, right, in receiving. And not that it's always about giving and receiving, but it's like the fact that I want to give before, not even with the intention of receiving. It's like, no, I don't want to like show up with my baggage almost, you know. It just feels good from that standpoint. So
yeah, the pre-existing condition kind of clause is exactly what you're talking about. It's like people need to be personally responsible for what they currently have going on. If something happens when you're a part of the community, then let the community help you with that. So specifics around this is we look back 5 years. If you've had something happen in the last 5 years and it happens again after you join, for the first 2 years, it's yours.
Yes.
After that, the community will help. Like, you've shown that you're a part of the community.
Yeah.
You've shown that you're not trying to dump it on the community.
Right.
But something bad happened, and you're like, okay, well, you're one of us now. Like, come on in, you know? And so that's the way that it works. You know, a lot of times if people have, you know, some chronic condition, high blood pressure, and they can't figure it out with lifestyle, and they have to take medication as a last resort, a lot of that stuff is so cheap. Like, don't worry about it. It's $15 a month or something like that.
Sure.
My family saved $20,000 last year on health insurance.
Oh my gosh.